Peripheral neuropathy is a condition where nerves are damaged, causing weakness, burning pain, numbness, tingling, and debilitating balance problems. Patients experiencing neuropathy can get the help they need. Dr. Ole Olson, owner of Central Iowa Neuropathy, joins us in studio today with more. Thanks again for being here.
Yes, I'm excited to be here. Thanks for having me.
Well, tell us, refresh our memory, what is peripheral neuropathy and what are some of the common symptoms of it?
Yeah, so peripheral neuropathy is literally just damage to the nerves outside of our central nervous system. So your central nervous system is your brain and spinal cord, and then the nerves leaving the spinal cord going out into your arms, hands, legs, and feet, even into your organs, is all considered peripheral neuropathy. Common symptoms can be more of a numbness, tingling, sort of a dead, heavy feeling. Can be more of a painful episode, could be burning pain, freezing pain, sharp electrical pain. And sometimes there's just simple things like a balance issue starting to become an issue, or even just itching can be an early sign as well.
Oh, really? When we see this picture here, we can see there are a lot of nerves in our feet, for example, so lots of places to possibly cause pain.
Yeah, and so what we do is we focus on attacking the root problem, which a lot of times is actually a circulation issue. So we look at circulation issues, we look at healing the myelin sheath, which is a protective layer around your nerve, and allowing those nerves to regenerate and repair.
What are some of the causes of peripheral neuropathy?
Yeah, that's a great question. So diabetes is the most common type. So diabetic neuropathy is the most common that we see. We see lots of chemo-induced neuropathy, which is probably the second most common type. The third type is called idiopathic, which really is a fancy word for we're not really sure. But there's about 100 different categories within that, which could be, exposure to certain chemicals, certain medications can cause it. Statins are a very common one. So there's lots of different things that can cause it, but really when it comes down to it, there's usually an underlying circulatory problem, and that's what we find most commonly with peripheral neuropathy.
Now, sometimes drugs can be used to treat this, surgery, but you offer a non-invasive way to reverse neuropathy. Yeah,
so instead of the managing of symptoms, we want to actually find the underlying cause and fix the problem. So we do a 16-point analysis as well as an advanced balance testing to determine what is going on with their body, what nerves are affected, how much damage there is, so we know exactly what each individual will need to get well.
And how does someone know this will work for them? Does this work for everyone?
Unfortunately, no. There's a certain point where the nerves get so damaged that you're really unable to do much of anything to help that person. So what I always stress to people is if you have any of these symptoms, get checked sooner rather than later, because the longer you wait, not only is it harder and harder to treat, but the greater chance that you won't be able to get help.
And you do have a seminar coming up soon where people can sign up and even get a chance to get this book.
Yeah, so we've got a couple seminars coming up here soon. Give us a call. We basically are giving away a free book for the first, I believe, 15 people that call. But basically it's a chance to come out and learn more about this condition, because a lot of people have symptoms that maybe mimic this and they're just not really sure. So it's a great chance to come out and learn more about peripheral neuropathy and see if maybe it's something that they need to get a further look at.
All right. Well, thank you so much for being here today.
Yes, thanks for having me again.
And if you want more information on Central Iowa Neuropathy, you can call 515-505-3700 or visit the website centraliowaneuropathy.com. Central Iowa Neuropathy is located at 210 Northeast Delaware Avenue, Suite 110 in Ankeny. Stick around, we are keeping your diet on track with a new cookbook and a simple and healthy recipe you can keep on standby for a busy evening this week.